So in the second module of complications, I wanted to focus on two primary issues. One is congestive heart failure, and the second is infection. Fortunately, these are very rare, but you need to know about them. Unfortunately, congestive heart failure does happen. Infections are much less common, but are serious and life-threatening, and immediate action is necessary. So infective endocarditis, basically the bacteria enter the bloodstream and they settle on valves. And this can happen from a number of things. It can be most commonly poor dentition, poor teeth, poor gum health, but it also can occur with infections from IV catheters or cuts that don't heal properly or aren't treated properly. And what happens is little clusters of bacteria, little germs, they'll grow and they can weaken and destroy heart tissue, including valves. Some of the symptoms a person might experience including fever, night sweats, unexplained fatigue or feeling unwell, and a physician is going to hear a new murmur on exam. There are some other more subtle findings that you can look up on the web, like splinter hemorrhages in the nails. I won't get into all that at this point. But understand who's at risk. People who've had rheumatic heart fever as a child, those with congenital heart problems, and there's a variety of those that if you have, you most likely know about. People with artificial heart valves, synthetic grafts and conduits. These are all risk factors for developing endocarditis, and hopefully your doctor talked to you about this before surgery and again before leaving the hospital. If you don't know if this applies to you, be sure to ask. It's critical that you know whether or not you need to take a prophylactic antibiotic. As I alluded to, oral health is really the best way to keep from getting this. Brushing after meals, flossing regularly. By that I mean at least once a day, twice a day preferred, and to see your dentist on a regular basis. Twice a year, unless you have periodontal disease, then you should be really seeing them every quarter. Keep an eye on skin for cuts and infections, particularly if you're diabetic. Make sure to use a mirror and take a peek at your feet and your toenails. This is a definite entry portal for bacteria to get into your system and not only cause problems with your feet and legs, but also has the potential to really mess up your heart and any synthetic grafts or valves. Many of these conditions require an antibiotic before dental cleaning or a procedure which could be potentially exposing you to bacteria. So make sure you ask ahead of time before you undergo any procedure, or if you're going to be seeing your dentist for perhaps a root canal or some other deep cleaning or procedure. Most often you'll need to take an antibiotic 1 to 2 hours beforehand. You can also get a wallet card so that you can show this to other physicians and dentists, and they will understand that they need to provide you with an antibiotic before procedures or treatments. And although it's tempting to be angered when you're turned away from a dental procedure because you didn't take your medication, understand that that's for your protection. Endocarditis will disrupt your life for the next year, not only longer, but also could result and necessitate additional surgery. Congestive heart failure. Basically, there's excess of fluid in the body, in the bloodstream, and it's got to go somewhere. And it results in a variety of symptoms including fatigue, weakness, shortness of breath, difficulty climbing steps, swelling, weight gain, feet swelling, rapid or irregular heartbeat. And it's important to be cautious with any anti-inflammatories like ibuprofen or Aleve, even aspirin. These can affect kidney function negatively, and that causes you to retain and accumulate fluid, which will worsen heart failure. Alcohol and tobacco are also detrimental to this condition. And those of you suffering from heart failure and heart surgery in general, it's recommended that in the initial phase after heart surgery that you consume a low salt diet, less than 2,000 milligrams a day, which really isn't much if you look at your package labels. But for people with CHF, it's a long-term dietary strategy to help minimize some of the complications and unpleasant side effects of congestive heart failure. So when should you seek care? When should you call your doctor? When should you go to the emergency department? Some guidelines here. Basically, if you're gaining more than a couple pounds in a day, or if you've shot up 5 pounds over your baseline weight, it's time to worry. If your legs and feet are swelling much more than typical or unusual, that's something that should be reported to your doctor. Certainly chest pain or what's called angina should prompt immediate evaluation. Palpitations and irregular heartbeat, dizziness, unexplained sweating, sudden weight gain and shortness of breath. The bottom line here is if you have any severe or worrisome symptoms, don't wait it out. Call 911. Seek immediate care. Time is critical in these situations. And I'm speaking to that as an emergency medicine physician who's cared for a number of CHF patients over the last 17 years of clinical practice. That wraps up part 2 of complications. If you haven't already watched part 1, please go back and do so.